Welcome to Measuring a Stoma, a topic from the video series WEB WOC's Ostomy Procedures and Techniques. This presentation is sponsored by an educational grant which is unrestricted from Hollister Incorporated, and the lecturer is Bonnie Sue Ralstead, so I will be presenting this content. As nurses, we all know that intact peristomal skin is the goal of ostomy care. It's achieved in part by correctly measuring the stoma. Yes, the pouching system must provide a secure seal with a predictable wear time. However, the first step in achieving that goal is to know how to accurately measure the stoma. Every stoma is a little different, as you can see from the stomas on this picture. The size and the shape are different, but they're all normal. They're all different kinds of surgical constructions of stomas also, a loop, an end, and an end which is actually a flush stoma. They are all variations. However, they all share one thing in common, and that is they are all going to change sizes. So with stomas, you always know there is going to be a stoma size change in the postoperative period or the short term. The edema during surgery resolves, and at that point, the stoma starts getting smaller. However, as the patient recovers from surgery and starts eating normally, they may start gaining weight. As the abdomen changes, so might the size of the stoma. So you need to be sure and be reassessing the stoma size. Weight gain and weight loss. Weight loss, for instance, a patient who is going to be doing subsequent chemotherapy following their surgery, they might have a significant weight loss. Whatever the change is, plan on the fact the stoma sizes will change. As we teach our patients, as nurses, as we teach our patients, as they are able to perform the skill, at home, the patient will measure the stoma with each pouch change, and so will we in their healthcare facilities. This instruction remains true whether the patient is using a cut to fit or a precise pouching system. So, how do we go about measuring a stoma? Well, here is a stoma measuring guide. The first thing you look for is a measuring guide, and there will be one in every package of ostomy supplies, no matter the manufacturer. Note the variety of openings. Those stoma sizes are going to be, you're going to be able to fit something for sure within those stoma sizes on that disc. The correct size of the stoma is the opening on the guide that will cover the peristomal skin without hugging the base of the stoma. Start with the opening that seems to fit the size of the stoma and work from there. If the opening is too small, the guide will touch or rub against the mucosa of the stoma. Select a larger opening on the guide to avoid selecting an opening that is too large so that peristomal skin is exposed. Remember, effluent can get on the peristomal skin and cause skin breakdown. Once the correct size has been determined, it should be written down on a resource sheet, a piece of paper in some way that the patient is keeping handy, with the date, or the date can be written next to the correct opening size on a measuring guide. The size written down on the resource sheet or the one marked on the sizing guide can be used as a pattern for the next pouch change. This is true for a patient using a cut to fit or a pre-cut pouching system. However, it's very important to know the size of the stoma, and you need to know it and write it down as well as a patient, because you need to have the size of the stoma when you're ordering equipment. What happens when the stoma is oval? We've seen all round stomas so far. We've talked about measuring them, but what if the stoma is oval? Well, oval or irregularly shaped stomas present completely different challenges. As nurses, we know that the size of the measuring guide must cover the peristomal skin without hugging the base of the stoma. And so this means your size must be selected based on the widest part of the stoma. Your pattern will be oval or irregularly shaped. It's going to be the shape of the stoma that you're sizing. And all peristomal skin will be covered. So that means it's going to be an oval shape in this situation. Begin by measuring the stoma across the widest part, then measure across the narrowest part. Mark the back of the skin barrier with the correct measurement and draw curved lines to connect the marks. Then follow the lines, as this patient is doing in this video, to cut out the pattern. As you remove the paper backing on the adhesive, it becomes your pattern for the next pouch change. It also indicates the size of the stoma. Save it and date it. Now, if your patient struggles with cutting the skin barrier or just plain using a scissors, you may need to teach a family member or a friend how to do the cutting in order to assist the patient. They can cut a few skin barriers in advance. When the stoma is round and the size has been stable for some time, a pouching system with a skin barrier opening already cut will save time and not require cutting. This is called a pre-cut system. So let's review. How do you know? The size, when it has been measured, covers the peristomal skin and it does not hug or infringe upon the mucosa of the stoma. So if you meet those criteria, you'll be in the right ballpark. You want to keep in mind that the size of the stoma, which will also be the size of your skin barrier, will never want to be placed over the top of a wet mucosa or the pouching system will leak. So stomas that have been measured too small so that the adhesive on the skin barrier will lay on the mucosa is going to not provide a secure pouching system. The pouch will leak because the mucosa is wet. Nurses play an important role in teaching patients and families how to properly measure the stoma and cut skin barriers if needed. Measuring the stoma is a foundational skill your patient will need to know as they become more independent.